Welcome everybody to our hip and elbow webinar part 2. So 11 months ago, Alan Ahearne kindly did part 1 of this, and it was very, very popular, and we learned a lot from it. So he's back by popular demand. So Alan is the orthopedic surgeon with Southview Veterinary in Clonmel. He's a very passionate vet, and he's very passionate about health in our dogs and promoting health in our dogs. So we're really looking forward to it. Anybody who'd like to ask a question, please do so via the chat button at the bottom of your screen, and we'll do a questions and answers session after Alan's presentation. Enjoy.
Is this sharing?
Yeah.
We can see this? Okay. Yeah. Good evening, everybody. I hope everybody can hear me. Again, thanks to the committee, Niamh and Ger and Louisa for having me back again. It's always kind of good to get an opportunity to speak with breeders about something as important as hip and elbow dysplasia and the screening systems that are there to try and hopefully reduce it in our breeds. It's been a busy month, or a busy year, I should say. There's been a lot of breeding went on, a lot of new pups, and I suppose inevitably a lot of problems going down the line. That just goes with the territory. We've done a lot of hip and elbow scores in Clonmel. I'm based in Clonmel, and yeah, most certainly we've seen a lot. To be honest, generally the scores have been quite good. The quality of the dogs out there is well, what we've seen has been good. It's been encouraging. But yeah, it's been a busy year. I guess I'm going to be touching on a bit of new material tonight, a bit of new information, but I'm also going to just basically go back over a few things that we covered last year. And you know, hip dysplasia is it's a complex enough condition. It can be difficult to get a handle on it at times, because it's what we call a multifactorial disease. So not alone have you the genetic component that the dog brings, but then you also have the environmental component that just the dog's day-to-day living brings, and that can be you know, the likes of weight management, or if the dog gets excessively heavy, or being over-exercised at a young age. That can most certainly feed into hip dysplasia as well. And you know, when you have the combination of weak genes and excessive environmental factors, you'll inevitably get, you know, clinical signs. So the textbook definition is hip dysplasia is a disease that stems from a varying degree of laxity, looseness of the hip joint, permitting subluxation, and I'll kind of explain better what subluxation is, during early life, giving rise to varying degrees of shallow acetabulum and flattening of the femoral head, finally inevitably leading to osteoarthritis. So a nice few medical bits and pieces there, but we'll kind of touch on that now over the next 10 minutes and try and get a better handle on it. But you know, that's basically it. And we can see this just schematic gives a better kind of handle on it. So, you know, the genetics that the pup is born with ultimately leads to these loose hips that we talk about. And then the environmental factors, you know, weight and excessive exercise on these dogs will lead to osteoarthritis, and then ultimately pain as they get older. Somebody I thought actually put it quite nicely to me there recently: 5 minutes per month of the dog's age for these dogs, you know, the dogs that are prone to hip dysplasia, isn't a bad way of looking at it when they're pups. So, you know, but unfortunately we do see people, new owners, they're often overzealous to get the dog with the lead, the pup with the lead and the collar on it. And gosh, you'd see them walking, you know, a mile, 2 miles, 3 miles, and the pup might only be, you know, 12 weeks of age. And or as soon as they get the second vaccination is often when they're walked excessively. So I suppose it's just client education really more than anything else. Again, I showed this one last year, but I kind of like it. It kind of gives a kind of an example as to what a good hip looks like on the left, and then what, you know, a subluxated hip looks like in the middle here. So we can see here that we haven't good seating of the femoral head, which is the ball here, into the socket, which is the acetabulum. And then we have in the good hip, we have normal forces acting on the joint. In this hip, we have abnormal forces acting on the joint. And of course, what do the bones do in reaction to that? Well, they remodel. And we can see this over on this schematic. You get this fairly kind of classical mushroom head on the femoral head over here, and then the flattening of the acetabulum. And what that schematic doesn't show is all the other little knobbly bits that form around the edges that contribute to the arthritis and ultimately pain, you know. So this is what happens in these dogs that have dysplasia. And this is I've just put up in the heading here, thoughts, right? So this is an X-ray we took during the year. Dog was 12 months of age. The owner wanted me to look at the X-ray. He didn't want me to score it. He just wanted to. He thought the dog was a little bit iffy on the hips, and he just wanted to take an X-ray. But it's a bully breed, and you know, you take the X-ray and you kind of go, what's going on here? The first thing actually that's probably worth noting is whenever we're taking these hip X-rays, we normally like to try and have the femurs. See these long bones here. Like to try and have them parallel. Now these aren't quite parallel, and sometimes with these bully breeds, it's very, very difficult to get them parallel because you have such a huge muscle mass in the back legs. You can see this massive, it's only 12 months of age, massive ham almost of a back leg. Now, you know, that X-ray is fine. You can most certainly determine what's going on here, and we can see this looseness. Right, say on the left hip here, I'm just going to, this looseness, we can see on the left hip here that it's not sitting in the joint as nicely as we'd like. And most certainly on the right hip, we can see that it's nudging out. So we can kind of make a presumptive diagnosis that this little dog has, or this big dog has hip dysplasia. Now, we don't have any huge secondary changes yet, right? We don't have any bits and pieces, kind of knobbly bits, or any huge changes in the femoral head, even though you could argue that this femoral head is beginning to get a little bit triangular looking. And you know, it most certainly is. So there is a bit of remodeling, even though the dog is only 12 months age. When we score these dogs, we will sometimes use the Norberg angle. Now, the Norberg angle is an angle that's used to determine how in or out the hip is, right? And we did the Norberg angles on these set of hips, and this is what it looks like, right? So ideally, the bigger that number, the better. And it should be greater than 105 degrees, right? And we can see here with this dog, 90.7 on the left hip, 93.6 on the right. So, you know, this is a situation whereby we have loose hips and we have hip dysplasia, right? So I did 2 of these, right? So this is another dog, right? Now this dog is, let's just see, can I zoom that up a bit there now? Let's see now. Yeah, can you see that? Okay, so this dog's hips are quite good, and most certainly on the right hip, we can see what we want. We want a tight fitting hip, right? And most certainly that's a tight fitting hip. I'd be happy with that hip. And then on the left, I'm kind of going, yeah, what's going on here now? It's not bad. It's quite good in actual fact, but there is a bit of space here. I hope you can see this, and I hope I'm not losing anybody by getting over technical, but there is a little bit of space here and just a tiny little bit of roughness here. I suppose the reason why I'm going through this tonight is the fact that it's often not a bad idea if you are getting your dog's hip scored to maybe ask the vet to have a little look at the x-ray so that you can get a feel yourself as to what's going on. Because, you know, as they say, a picture tells 1,000 words. So if we were to do the Norberg angles on this dog, escape, and here we go, we can see that our initial worries have been, you know, I suppose they've been cemented, because
You there, Alan?
You've seemed to have frozen now.
an overall score of 8, not bad. But yeah, just a small bit of an issue there. Okay, so just to give you an idea as to get a handle on scoring and what's going on, right? This then is just a kind of an image. It's actually one of our own pets that come into the place, of a dog that has awful hips. I mentioned this fella last year as well, because this guy cracks me up. We took the x-rays on this dog when the dog was 8 years of age. It arrived into the clinic. It comes in every year for his boosters and just checkups and whatnot. Great little guy. And for the first time at 8 years of age, came in lame. And we said, you know what, look, in case it's a cruciate injury, or, you know, maybe it's got something wrong with its hips, we better take an x-ray. And lo and behold, when we took the x-ray, this is what we saw. And you can see here, you know, massive changes in the hip joint. You know, lot of changes in the femoral neck, femoral head. This leg over here, big time. It's almost out of the joint. And yet, clinically, amazingly, this little guy isn't so bad. And I suppose it helps that it's this guy. They're a small little dog. Well, when I say small, he's probably 12 kilos. But the owner is good now, was carrying a bit of weight. I suspect that's what contributed to its lameness that time. Back on a big diet, getting kind of controlled exercise, and every now and again, when things go pear-shaped, goes on a few anti-inflammatories and we're okay again. So that's just, again, another image of severe hip dysplasia. You know, for people that are new to the webinar tonight, I just briefly go through what's needed when you're getting them scored. The dog needs to be microchipped for identification purposes, needs to be a year old for most of the schemes. The OFA, which is the American organization, required them to be 2 years of age. And the BVA require you to have a kennel club number, deep sedation, general anesthesia. And then these are the things we put on the plates: the microchip number, the date, left and right markers, kennel club number, etc. And we use the hip extended view, which is where the dog is on its back, the 2 legs brought back, and positioning and exposures are right. And then we have to send it on a special software known as DICOM software. So that's fine. This is the report that you'll get back. So just as regards sending the images off, and again, we touched on this last year, the 2 schemes that we traditionally use are the BVA scheme in conjunction with the Kennel Club in England, and also increasingly now the Australian system. And they both use the same scoring system. And we ended up, 18 months ago, I wasn't aware of the Australian system, but with COVID and whatnot, the BVA system got quite slow, and we were assured that the Australian system used the same scoring system. We did a good bit of research. All the credentials were good, and the Irish Kennel Club recognised them. So they've been used quite a lot since then. They have a very, very fast turnaround. But in fairness to the BVA, their turnaround has improved. It's still not as fast as the Australian system, and I suspect never will be, but that's fine too. But they're the two kind of main schemes being used at the moment. I'd say I've only 3 times been asked to submit x-rays to the American system, the OFA system. I've never been asked to submit them to the FCI system, which is used on the continent. And then there's finally the German Shepherd system, which is peculiar to that breed, and it's for dogs that are showing on the SV circuit. And I won't spend much longer on this, but just to mention this scoring scheme, which is the traditional scoring scheme. It's a grand total, a maximum score for each hip of 53. So the biggest score you can get, I mean, basically the hips would want to be almost in different rooms to get the maximum score. I mean, you're looking at a score of 106, but generally, like on that last x-ray that we showed, you know, we'd like them in single figures or most certainly low teens. They mark them out of 6, apart from this particular one, which is marked out of 5. For me, I generally look at these two first and foremost, because they really give you an idea as to, I suppose, the genetic component of what you're seeing. All the other bits and pieces, the cranial acetabular edge, dorsal acetabular edge, etc., they're often secondary changes due to loose hips. But the Norberg angle and the subluxation, they kind of measure how loose the hips are in the first place, if that makes sense. That's only for your own records if you want to download the webinar, but that basically gives you the landmarks as to what the previous scoring system was looking at. So for instance, cranial acetabular edge, that's that little piece of bone there. Cranial acetabular edge, that's there. Okay, so that basically gives you an idea as to what goes on with that hip scoring. Okay, and we mentioned the different schemes, and again, that's kind of how they stack up as regards, you know, comparing one with the other. For instance, if we were to look at a 5 to 10 score on the BVA and the Australian system, well, that would kind of equate to a good on the OFA system, or an A2 on the FCI, or an A normal on the SV. Right? So that's kind of an idea of the different schemes that are out there at the moment. What is worth mentioning though is the other scheme out there, which is the PENN hip scheme. So there's been a lot of work done in the States, not just the States, but a lot predominantly in the States, in the PENN hip scheme, and it's a slightly different way of measuring the looseness in the dog's hips. And the research has basically supported the fact that this has a higher degree of predictability in determining whether the dog is a carrier for hip dysplasia genes or not, because it uses an index known as the distraction index. So it involves sending 3 x-rays to PENN hip. One is your traditional extended view, the one that's taken on the other schemes, and then they take 2 more. So they take another one with the dog in a frog-legged position, and the third one then is the dog in a frog-legged position, but with a foam block between the 2 legs, and the 2 legs are squeezed against that foam block, and you get the hips being pushed out. And and it's how far they can be pushed out is measured, and that gives us the distraction index. And it doesn't change significantly over time, and it can be reliably done on pups over 16 weeks of age. And it is that's an image of a PENN hip X-ray, right? So we can see the space here, what they measure. And I don't know if you can make out this foam or this gray line here, this gray line here. So they're the two foam bars that are put between the two legs. The two legs are squeezed in against those, and an image is taken, an X-ray is taken, and that distance is measured, right? And you end up with this thing called the distraction index. So, for instance, internationally, the guide dogs use it. A lot of the working dogs use it, and a lot of the service dogs use it. And increasingly, I could see it, you know, becoming more popular. Again, that's just for your own records if you want to go back on this, but that goes through, you know, basically how they measure the distance, right? You have to be certified with PENN as a vet to be able to do it. And the reason for that is they want to make sure that every vet that does it is on the same page, and that you know that they're certified, right? Based on the distraction index, the dog is ranked then within its breed. So I've copied and pasted this and cut out the kind of relevant information. This is one we did there about a month or two back, and we can see here that this dog, the distraction index on the right was 0.28, and the one on the left was 0.21. So the lower the number, the better. The biggest number it can be is 1, and the lowest number it can be is 0, right? So we normally like the number to be kind of in around here, less than 0.4 if possible. And you know, they where did I see it? Oh yeah, so this is interesting, I think, anyway. There's been 38,000 Labradors already through this scheme. So that's a fairly significant cohort. And based on that, they're able to come up with breed averages, and they're able to tell you where you're in within the breed average. So there is the breed average, and this is where this dog came in. So this dog is in good shape. You know, they recommend to breed in the top half, right? So so that's basically an overview of PENN. So I guess we'll talk about this towards the end of the talk, and maybe even about a few questions. You know, the screening tests are really important, but we need to try and get more data from them. And I think as a country, or as a country, we need to probably try and harvest more data than we're harvesting at the moment. We're sending our images away, and you know, we're not necessarily getting the information collated and put together and giving us more information back. So that's something that I think could improve if we put our minds to it. Okay, so elbow dysplasia is a nasty one as well.
Alan, just before you go on to elbows, can I just remind everyone that the chat button at the end of your screen, if you have any questions, you can send them in at any stage to go over at the end of the presentation. Thanks.
Okay, so elbow dysplasia is a complicated disease as well, because it's made up of kind of three individual conditions that can happen either on their own or in conjunction with the other two. Sorry, 4 conditions. Sorry about the acronyms, but there you go. UAP is ununited ankylosing process, FMCP, fragmented medial serious.
You're frozen there. Oh, you're okay again now.
Are we okay? Yeah.
Yeah, you just seemed to freeze for a minute there, but you're back online now. Okay.
Will I go through that slide again, Anne? Okay. So
yeah, it might be no harm because we lost you a little bit there. Yeah,
okay.
If you don't mind.
Yeah. So basically, I think it was frozen out of it there for a minute or two. But basically, just getting back to that elbow dysplasia slide, it's made elbow dysplasia horrible condition. I really don't like it because you know, the elbow is in the front leg. The front leg is the weight-bearing leg in the dog, and a dog can tolerate hip dysplasia to a certain extent if we box clever with it, but it's very, very difficult for a dog to tolerate elbow dysplasia. And there's no surgical intervention worth talking about really as the dog gets older to manage elbow dysplasia. So heavily reliant on medication and physio and whatnot. But the 4 different conditions, UAP, which is united ankylosing process, FMCP, fragmented medial coronary process, OCD, osteochondritis and elbow joint congruity. There's no point in really getting into the nitty-gritty of those 4 diseases, just to say that either one or all of them contribute to elbow dysplasia. The elbow is made of 3 bones, radius, ulna, and humerus. It's a hinge joint, and if any of them are problematic, we can get elbow dysplasia. So this is just a kind of a little diagram of it. And I think from a screening point of view, and we'll just go through a couple of images now in a minute, but from a screening point of view, the thing that I want you to look for, if you're ever asked, if you ever get a chance to look at your dog's x-rays after being x-rayed for elbow scoring, this bit, just this little bone here, this little piece of the bone here, just get your eye in for that, and get used to looking at it whenever you're checking your x-rays, because it's in here that we score them. Okay, let's see now. Zoom in. Right, now, can you see this little roughened bit? I hope you can. The arrow is pointing to it. It's just it's very very subtle, and that is, would you believe, measured in millimeters across, and that's a grade 2. So the elbow dysplasia is graded 0 to 3, so 4 grades, and 0 is the best, 3 is the worst, and that's a 2. So basically we've seen a little bit of reaction because the joint is unstable, and that's the easiest way for the scrutineers to determine whether the dog has elbow dysplasia or not. So that is just that's an example of that. Okay, so that's a 2. This one is a 2 as well. Just zoom in again, and we can see this little roughened bump. You blink and you'd miss it, but that is a 2 as well. And remember, there's only 1 grade worse than this, and that's a 3. So yeah, so it's subtle, but this dog doesn't have any clinical signs. Obviously, this is just from a screening point of view, but going forward, it could develop clinical signs. And this guy was a 1. So again, a little roughened bump here. That was a 1. Okay, so we can see that's the humerus, the ulna, the radius, and it's just there. That's a kind of a sentinel sign. And again, it's a grade 1 there. And this one was a grade 0, I think. Yes, so this is a nice slope. There was no roughened bits in it, and this was a 0. That's what we want. So this just kind of brings me on to now I know I kind of hurried through elbow dysplasia, but there hasn't been any huge changes in how they're dealing with that at the moment, and we saw a good few poor scores come back during the year, so it's very much out there. Some breeds worse than others. Well, certainly the poor old Bernese, seen it in a good few dogs, and labs, but it's in every breed. And in actual fact, over the last 6 weeks, in my pet owner side of things, I have seen 2 Shih Tzus with quite bad hip dysplasia. Just getting back to the hips there, just came into my head. And we can often forget the smaller breeds when we're talking about hip dysplasia, but certain small breeds most certainly struggle with it. So we touched on the collection of data there a while ago, and you know, there's some good things can be done when you can get your hands on data, and in the UK now, you know, they have these estimated breeding values. So you know, they're there to try and give a better prediction as to whether the dog has the chances of passing on you know, hip or elbow dysplasia to its progeny. And basically what they're doing is they're gathering not alone the dog's, if you had a stud dog, not alone his hip and elbow scores, but his, if they can get it, his parents' hip and elbow scores, and then you know, if you can get it, then the progeny hip and elbow scores. So the more information they're getting, the more accurate the estimated breeding values are. And these seem to be quite a kind of a nifty tool for breeders to, you know, try and be more confident that they're not passing on anything that's, you know, less than desirable in their pups. You know, they talk about the confidence scores. So the confidence scores are a reflection as to the amount of data that's gone into the estimated breeding value. So the more, you know, parents and progeny that go into the score, the higher the confidence value. You know, they're done, they're checked 4 times a year, or they're updated 4 times a year. And I think the oldest that they'll do it is up to 4 years of age. They are, yeah, and they're being used quite a good bit in the States as well. And that's basically it. The lower the number, the lower the risk with the estimated breeding value. So that's basically an overview of hip and elbows, folks. I'm conscious that I kind of rambled on a little bit too much last year, and so I tried to keep to the 30-35 minutes this year, and hopefully leave room for questions. That's basically where we're at the moment.
That's brilliant, Alan. Thank you.
No problem. Thanks, Steve.
Get your questions in there, guys, at the chat button. No such thing as a stupid question. Now's your chance.
Absolutely.
Alan is open to answering any of your questions. So Jill has a question, Alan.
Yeah.
Can you ask Alan, for large breeds like a golden retriever, would having a 0-1 elbow impact the dog breeding wise? Would it be ethical?
That's a really good question. And it's a very tricky one to ask to answer because ideally really we're looking for 0-0. That being said, yeah, that being said, 0-1, you know, if you're breeding it with a 0-0, you might be okay. But once there's any little bit of reaction on that piece of bone we were looking at, it generally means that there is a degree of elbow dysplasia there. It's a highly genetic condition. And I suppose at a push, I probably advise you no, but I know plenty do breed with the 0-1 and haven't shown any huge ill effects, but in an ideal world, I'd be saying no, Jill. Yeah.
Okay.
That could be a tough line now, and a strong line, but yeah, I'd be interested to know what other people think on that one now, but yeah.
What about doing prelim X-rays for hips on puppies?
Yeah, with I guess it's a good idea to a certain extent, because I guess if you're thinking about breeding a pup and you you wanted to get a handle as to whether the pup had hip or possibly even early elbow dysplasia, you will pick that up. In serious cases, you'll pick it up in less than 12 months of age, most certainly with the elbows. And if you're used to taking hip and elbow scores, you'll pick it up in the hips as well. And at least then it'll give you the opportunity to neuter the pup if it's a thing that it looks, you know, as if the pup has hip and elbow disease. So it's not a bad idea. So yeah, no, it's not a bad idea. Yeah.
Do you think problems with joints start in the whelping box, as in when they're being reared by the breeder, jumping off walls or slip sliding on tiles, that kind of thing?
Yeah, I do and I don't. I think that it can be overstated. You know, if I had a penny for every dog I heard that jumped out of a window or jumped off a wall before it came in to be hip and elbow scored, you know, I'd be wealthy at this stage. Because, but that being said, I think when we're dealing with you know, pedigree breeds, it is important to be careful with them at that, you know, very, very important, you know, up to 12 weeks of age, because they do a lot of growing at that stage. And you know, they are delicate and all the rest of it. I guess where it becomes more of an issue is when, if you had a pup, and it's getting back to the first or second slide we showed there, is if there's any degree of hip dysplasia there, or if the gene is there and they get excessive rough and tumble, that could result in that gene being expressed more profoundly and earlier than it could or should have been, if that makes sense.
Okay. How do crossbreeds compare? Sorry, that question has just popped up. 1 second now. How do crossbreeds compare to pure breeds in the incidence of hip and elbow problems? Okay,
well, it depends on the crossbreed to a certain extent. And it depends on what pure breed you're comparing them against. You know, certain pure breeds, unfortunately, the gene pool isn't huge in Ireland. So we see that they're overrepresented when we you know, trawl through hip and elbow data. Certain crossbreeds, you get a thing called hybrid vigor. So you get the positives of both breeds, and you can end up with quite a robust little dog. Other crossbreeds, unfortunately, the hip and elbow dysplasia gene can be the one that seems to get expressed more than any other negative gene. You know, for instance, with Cavaliers, and the Cavaliers has been crossed quite a bit. Cavaliers are very prone to heart issues, yet the crossbreeds, we don't see those heart issues to the same extent that you'd have expected to. So there's something positive going on there. But with some of the doodle crossbreeds, unfortunately, we are still seeing you know, a significant amount of hip and elbow dysplasia, most certainly elbow dysplasia. So it's hard to say, really. You know, there isn't, because you're dealing with crossbreds, there isn't a kind of a set rule, you know.
Yeah. The next question: what would be the earliest stage for scans to be scored successfully, and how long after a heat would you recommend to do it in females?
Sorry, Niamh, what was the first part of that question again?
The earliest stage for scans to be scored successfully, and after how long after a heat recommended in a female? All right,
so the earliest, the early stage that you could X-ray a dog, is it?
Yeah.
You know, with the traditional schemes, the BVA and the Australian system, we require them to be 1 year old to send them off for scoring. We mentioned the PENN hip earlier on. PENN hip will do it from 16 weeks. You get accurate results. as regards the bitch being in season, that's a good question. There's been a good bit of research done on this, and it has shown that the bitch being in season has no effect on the HIP score, either positive or negative. So there is no problem in getting a bitch that's in season scored. Doesn't affect the score.
Interesting.
So that's it. Actually, in anticipation of the talk tonight, because I hadn't heard anything about this pup scan that was going on a couple of years ago, and I know UCD kind of got involved in it, and I spoke to them, and they have no updates on it. Doesn't appear to be anything happening up there at the moment. Now, I do stand to be corrected, but that was just an inquiry I meant with the radiology department in UCD, in the vet college in UCD at the moment. So just when somebody mentioned about the earliest, there doesn't seem to be much going on there. Yeah. Okay.
Can an accident result in high scores on both sides?
Oh yeah, absolutely. You know, if if a dog had an accident, a significant accident that resulted in trauma to the hips, you know, you most certainly will see secondary changes, and those secondary changes are counted in the hip scoring process. I mean, if we go back to that, which one is it now? This one. All of these lower markings are associated with secondary changes to the hip joint. So if you ended up with trauma to the hip joint, you most certainly would get scores there. But it would want to be a significant accident, Niamh, you know. You know, it would want to be fairly traumatic. You know? Yeah.
Next one. Emer, the BVA don't recommend or mention hip scoring for my breed, Shiba Inu, but I'm seeing more and more dogs internationally, Russia, Europe, USA, being hip scored, some with high scores. Can I still get it done here? The same goes with patellas, no scheme here, but testing a lot done abroad.
Well, yeah, no, there is a scheme for the patellas.
You're frozen, Alan. Sorry, guys. While Alan is sorting out his computer, Munster Agricultural Canine Society, we are open to any ideas you guys might have of any webinars you might be interested in and what subjects you might like to see us do presentations on. So if you have any ideas, you can come back to us on that. And also we have our championship shows. We have an international show and a national show in July on the 23rd and 4th of July with wonderful judges. And we're looking forward to seeing you all there. Are you back, Alan? I think I've lost him.
Yes, he seems to have disappeared, though his screen is still up. I'll try messaging them now to see. Oh, he says it's not allowing him to unmute. So, Jared, could somebody deal with that?
Yeah, so the question was regarding the patellas. Now, there is a scheme out there to score patellas as regards luxating patellas. It's known as the Putnam scheme, and it marks them out of 4. It's done by your vet while the dog is conscious, and you'll get a score of 1 to 4, and it's a very easy test to do. And so yeah, so I mean that there is a test for that. So it's the Putnam grading system for luxating patellas. That breed, you see, you can still get these dogs scored, right? And you will get a score, but you mightn't get, well, you won't get a breed average, a breed median. You won't get any relevant information to that breed, but it will be scored in the same way any dog will be scored. And you know, I guess if there was any amount of international data available as to what the breed averages were, you could compare it against that, if that makes sense.
Okay. You said earlier that elbow problems were difficult to find a cure for. Did you mean that some elbow problems could be treated with medication rather than surgery?
Yeah, well, yeah, no, what I meant was that, like, there really isn't surgery available for chronic elbow dysplasia. You know, if you have a dog that's in pain, you know, has obvious arthritis in those elbows, you know, you're looking at weight reduction being the big thing, physio also helping, medication helps as well, and you know, there's any number of different you know, meds out there for it, but but yeah, once that change the elbows happened, it's very, very difficult to stop it from getting worse or to change it.
Would you recommend surgery on a 5-month-old puppy that comes in lame with elbow issues?
Oh, so that's slightly different. So this is a pup that's pre secondary changes. So so absolutely would be the answer to that. Now, unfortunately, diagnosing what one of those 4 conditions that we mentioned that cause elbow dysplasia, you might find it with an X-ray. Sometimes it can require a CT. And if it's a thing called a fragmented cornoid process or an ununited anchineal process, both of those can be managed surgically. It's you know, highly specialized surgery. There's a couple of places in the country do it, and yeah. So getting the diagnosis is the big thing first. Which one of those conditions that are contributing to elbow dysplasia is it, and then taking it from there.
Okay. What's your opinion on joint aid supplements?
Yeah, you know, I mean, they have their place. You know, I think you need to be fussy as to which one you use. You know, there's an awful lot of, you know, rubbish ones out there, and there are some really good ones, ones that have the proportion of omega-3 to omega-6 and chondroitin and glucosamine, you know, and good quality ingredients, they most certainly can help. Basically, like what they help in doing is they help to keep healthy cartilage healthy. So they won't have a massive effect on cartilage that's already become diseased and whatnot. But they will hopefully prevent the remaining cartilage from getting worse. That makes sense, you know.
Okay. And from a natural point of view, what about turmeric?
Oh, turmeric definitely helps. Yeah. It's a natural anti-inflammatory, and you know, because it's you know, it's used to kind of liberally, and it's hard to quantify exactly you know, what its effects are. But most certainly, I've seen it firsthand that turmeric can help. Yeah, definitely.
Okay, and there's only one more in, I think. How can we go about setting up a database to record our data here in Ireland? Do we campaign the IKC, or how does it happen?
Well, you know, yourself and myself, Niamh, have spoken about this before. I don't think that it's as hard to do as you might initially think. I think that we don't necessarily need to look about setting up our own panel of scrutineers here if we didn't want to. We could most certainly use the scores that we're getting from abroad. It doesn't really matter in today's world, with kind of a global world, where they're necessarily scored. It's what we do with the scores when they come back that really can make the difference. If somebody within the IKC would be willing to put their hand up and take this project on, I think it would be an absolutely fantastic thing to do for the dog breeders and the dogs of Ireland. I think it could most certainly be done. Yeah. And I mean, the extension of that then would be, developing it into, breeding, estimated breeding values and getting greater confidence in the breeds and in the scores. So yeah, I think it would be a great thing to do.
Yeah, and I suppose from that point of view, having it as a standard that it's on all the registration certificates, so everybody sees it there and then.
Yeah, exactly. I mean, getting all the breeders on board, getting them to realize the importance and the value in doing it, and just making it a kind of just almost a voluntary kind of thing to do would be fantastic,
Okay, that's great, Alan. We're finished our questions very quickly. Everyone got them in fast. I don't have any more. So at this point, what I'll just say to people again is, if you have any ideas, contact us even through our Facebook page, Munster Agricultural Canine Society. If you'd like us to host any webinars for you, give us your ideas and your subjects, and we'll do our best and see what we can do. And with the show season starting, don't forget we have a weekend of our international and our national show in July on the 23rd and 4th in the showgrounds in Ahearne in Cork. So thank you all for tuning in, and thank you so much, Alan, for giving up your time again.
Thanks very much, guys, for having me. Really appreciate it. So it's a pleasure. Thank you.
And I presume if anyone wants to contact you, they can contact you through the veterinary hospital in Clonmel.
Oh, absolutely. Anytime. Yeah. Only delighted to. Yeah.
Great. Thanks a million.
Thanks, guys. Bye-bye.
Good night.